another edition of All Things Nursing, where we're going to cover leadership and management, and today's area of focus is management functions. So without wasting much of your time, let me give you a quick outline of today's topic of discussion. So we're going to begin by discussing the management functions individually. So we're going to cover planning, organizing, leading, controlling, and also staffing. So let us get into our today's objectives. So management functions are the core activities that guide how organizations operate and achieve their goals. So they provide a structured way for managers to plan, organize, lead, and control resources effectively. So let us begin with the first one. They're not in any particular order. So let's begin with planning as a key management role. So if you have any questions, you can drop them in the comment section. Any contribution, leave it in the comment section. Let us begin with the first one, which is planning. So when you're looking at planning, this is an intellectual process of setting objectives, forecasting future conditions, and determining the best strategies to achieve the desired outcomes. So it involves analyzing current situations, predicting patients' needs, and preparing contingencies. So in the hospital setting or hospital context, or this would be an example right here. So in a ward, planning means anticipating patient admissions, then preparing for emergencies and setting clear treatment protocols. So it also includes long-term strategic planning, such as improving patient satisfaction scores or reducing hospital acquired infections. So the key elements here are goal setting, forecasting, policy development, and contingency planning. Let us look at organizing as another management function. So when you're looking at organizing, this is the process of designing the structure of an organization where a manager defines goals, allocates resources, and establishes authority and responsibilities. So it ensures that plans are translated into actions through clear framework. In the hospital context, in a ward, organizing involves assigning nurses to shifts, disseminating responsibilities, for instance, medication administration and wound care, and also ensuring equipment like ventilators or monitors are available and functional. It also includes creating communicating channels between doctors, nurses, and staff. So the key elements here are division of labor, resource allocation, coordination of tasks, hierarchy, establishment. The third management function is leading or directing. So leading is the interpersonal aspect of management that focuses on influencing, motivating, and guiding employees to achieve organizational goals. So it includes communication, inspiration, and conflict resolution. An example would be a manager or head nurse leads by motivating staff during stressful shifts, fostering teamwork, and maintaining morale. So leadership also includes setting a positive example in patient care and also encouraging adherence to ethical standards. So the key elements here includes motivation, communication, supervision, conflict management, and inspiration. The fourth management function, we have controlling. So controlling is the process of measuring performance against established standards. So identifying deviations and implementing corrective actions. So it ensures that it ensures that organizational activities are aligned with goals and quality standards. So in a word, controlling involves monitoring patients' outcome, tracking infection rates, auditing medication administration, and ensuring compliance with hospital policies. So if patients' discharge time are longer than expected, managers investigate and adjust the process. So here the key elements include performance measurements, quality assurance, corrective action, feedback loops. Let us look at our fifth management function, which is staffing. So staffing is a process of recruiting, selecting, training, and retaining employees to ensure the organization has the right people in the right places or roles. It also involves workforce planning and succession management. So, in a hospital context, staffing in a ward means ensuring a just nurse to patient ratio, hiring specialized staff, for instance, intensive care nurses, public health care nurses, and midwifery, and ensuring that they provide ongoing training in new medical technologies. So it also includes managing burnout and turnover. So here our key elements include recruitment, training development, retention, and workforce planning. Let us also cover coordinating. So coordinating is a process of harmonizing activities and efforts across different departments or individuals to achieve a common goal. So it ensures unity of action and prevents duplication or conflict. In a hospital context, in a ward, coordinating means aligning efforts of doctors, nurses, pharmacists, and lab technicians so patient care is seamless. So, for example, ensuring lab results are available before ward rounds or surgical teams and other members of staff are also synchronized. Then, our key elements here are integration, collaboration, and communication. Let us look at our last management function, which is decision making. Decision making is the cognitive process of selecting the best course of action among alternatives. So it involves problem identification, analysis, evaluation of options, and choosing the most effective action. So in a hospital context, in a ward, decision making includes determining whether a patient should be transferred to ICU, prioritizing which patient needs urgent care, or deciding how to allocate the limited resources like ventilators during a crisis. Our key elements include problem identification, evaluation of alternatives, risk assessment, and choice implementation. So these are management functions. If you have anything new, you feel free to add on. Then, just in conclusion, so together these functions form a continuous circle. So managers plan, they organize resources, they lead staff, they control the outcome, and they make decisions, all while staffing and coordinating to keep the ward functioning smoothly. So this marks the end of our today's presentation. If you have any contribution, feel free to add on. If you have anything, a special request, you can let me know, then I'll do a video on it. If you have any suggestions on how best I can do the videos, you can also let me know. Other than that, have a blessed day.